All right, so let's dive right in. Krista, you're someone who's got an incredible track record of building high functioning leadership teams, developing corporate strategies that really work, and achieving strong growth and positive financial results. As you look at the landscape of value based care, it really relies on this tight relationship between payer and provider. And as we know, it has not always been the case and is not always the case that providers and payers collaborate. So tell me about that dynamic as you're shifting to value-based care between payer and provider.
There are challenges. It's hard sometimes to get aligned around kind of the right things so that everybody can be, moving in the same direction. And for us in particular, because we're part of an integrated system, there can even be a different dynamic as we're talking about, providers that are not part of our system compared to providers that are. And interestingly enough, sometimes, external partners work better, sometimes internal, just depending upon the day, the topic, right, that we might be focused on. But certainly, like, as we think about those dynamics, what can we do, right, to make that easy for providers? Can make it obvious that value-based care is the right thing? I think we take for granted at times the power of the data and information that we have within the plans. And that truly is something that most provider systems just either they don't understand or they don't have strong analytics. A major thing we can do, I feel like, to try to create some synergy is just be really open and transparent with data sharing to help them understand, right, what's going on with the populations they serve. How can we work together to address, health issues? That's our greatest opportunity to create alignment. If we can be willing, right, to share that with them and help point them in the right direction, and then perhaps wrap around and provide support in helping them execute, I think that can create a ton of alignment. And then probably most obviously, at the end of the day, most providers and payers want the same thing, which is healthy patients. Sometimes we forget, when we get sort of crossways in these conversations. Yeah. But at the end of the day, if we can just refocus ourselves on, taking care of individual patients or taking care of communities, sometimes that makes getting to the right answer that much easier.
I'm super curious to dig in more on what you said about data and any examples you have of where sharing data with the providers have sort of unlocked that resistance or help them feel like they're on the same side. Because I'll definitely admit, as a practicing doc, I've gotten letters in the mail from plans over the years, and they may end up in the recycle bin or the PHI bin because either the data is wrong or it's not clear why I'm being sent something. So how have you used data to sort of bring down provider resistance and build the relationship?
Yeah, I think you made a really good point, which is, number one, we have to make it clear and easy to understand. We can't expect a provider, right, in their busy day with thousands of other things, running from appointment to appointment, that they're gonna, open up a piece of mail and know, right, exactly what it means. And so there's certainly elements of training and education that have to go with it. The other piece that we often struggle with, you also brought up, which is, it doesn't feel right. We often hear that from providers, and, the struggle from the plan side, and certainly my perspective as an actuary by training, the data is never perfect. Mm-hmm. You will never have it be perfect. And so there's an opportunity, and perhaps you have advice, right? How do we get providers to understand, it's not going to be perfect, but let's use what we have, what we know, what we can see from the data to help us get aligned. So, we do have, I think, some examples where we have been able to effectively kind of use data, and it often is highly dependent upon having, either a data savvy physician or a data savvy leader that is highly trusted and connected with the physician. That seems to be sort of a key pivotal point. We get it to them, then they can help with, sitting down with the physicians to say, all right, here is what the data is saying, and helping them understand and being sort of that bridge. That's been really, I think, a fundamental, when we've had successes, that's been a fundamental factor of it.
So the messenger as much as the message itself.
I have noticed at times, sometimes a translator, as I term it, can be super helpful. You can have two people, and I've been in these meetings where they actually agree They just have no idea they agree, and they're
Yeah.
arguing over something they agree on. And so, right, making that maybe strategic use of a translator to help, or being willing to admit you can't reach the audience in the way that you'd like to. So how do you find somebody that can effectively kind of partner with you to do that?
And is there a particular piece of data that you've seen melt provider resistance? What's the hook that gets providers interested when you can show up with the right messenger and bring them something of value?
It depends, on the specialty. So what might be effective for an orthopedic surgeon? They tend to be a little less driven by their hearts, right, and a little more
Yeah.
driven by their heads. And so they're going to want to see more concrete data, more specific numbers. I think that tends to work. Other provider specialties can be driven a little bit more effectively by that heart, right, and just starting with sort of that patient lens. And so that's the other piece, actually getting to know the different, sets or specialties, and the providers you're working with. And over time, if you're paying attention, you will learn, what's going to be most effective. Do they just want a hard data sheet and that's going to get them and that's all they need, right? And then you can just back off. Or do they need stories? Right? Do they need experiences? Do you need to bring forward a great example of a patient who, this was an effective way to manage their treatment, or, this treatment costs so much less and has the same outcome, and that really had a huge impact, right, on their life. And so it is sometimes, understanding what is going to be best received, or most effective in helping that physician individually or as a group understand.
Yeah, it's so true. Sometimes we can show up with all the spreadsheets in the world, and what really connects with people is a story, as much as any spreadsheet. I'm curious. You mentioned a couple of challenges that plans face in sort of leading the charge towards value-based care. One is kind of like having the right storyteller and the messenger. Another is you're limited in the accuracy of the data that you have. Another is sort of the trust component. What else do you see as challenges that as you're trying to overcome and pull everyone forward into the value-based care world? What else are sort of the unique challenges from the plan side?
It's probably provider and patient engagement. So we can do absolutely everything right from the plan side, right? We can give all the data, all the support, right? Everything, an organization needs, a provider organization needs to be able to make the right decisions. But at the end of the day, we need the provider, right, in the moment to do it. And
Mm-hmm.
we can't do it for them.
Mm-hmm.
And so I think that's a frustration. That's a challenge point. There's a lot we can do, but at the end of the day, we do hit an edge, right, to what we can do. And then on the sort of people or patient engagement, it's the same thing. We need the patient to make the right decision in the right moment to support value-based care, right? So we can define, benefits that really help steer folks to the right thing. We can create all kinds of programs to help keep them healthy. But if that diabetic, right, doesn't engage in that program to become healthier, you can only do so. So I think for me that's the biggest challenge. If we could do it all end to end, we would love to.
Yeah.
Um, but we can't. And that I would say, many of the other challenges we can overcome, but those are real challenges that are kind of fundamental and core. How do you get providers to engage? How do you get patients to engage?
Yeah, it's so true because again, I mentioned like being a practicing doc, getting pieces of information or decision support from different payers, and not necessarily acting on them, I'm sure, in the way that the plan might want to, and certainly as a patient getting emails from the health plan and not necessarily probably responding to them, probably a bad actor both as a practicing doc and as a patient in terms of. But I want to go deeper into this because you did something really unique, I think, that took a lot of leadership, which is, as the CEO of a plan, you recognized that this was a big problem, the engagement of the provider, the engagement of the patient, and you basically went straight into the health system, into the provider world, into the patient world. And rather than kind of like chipping away on the edges, you're trying to deploy technology into the provider space and into the patient. So Tell me more about that. Like, how did you get to that point where you made that decision to deploy technology straight into the care delivery space?
Yeah, so it's interesting that you kind of phrase it as thinking it was unique and a true leadership moment, because I felt like it was easy because it was an opportunity to make it easier for the provider to do it in the moment, right? So I can't be there in their room every time, or have a
Yeah.
nurse right in their room every time to say, don't forget to check that box, don't forget to ask about. But I can help, with technology, make it easier, make it become a habit, make sure they are always prepared with the best possible information to do what the patient needs in that moment, in that sort of setting. And it's so easy to sort of blame the providers for not doing it. But like we talked about earlier, there's a thousand things with the implement of EHRs. It's not like providers actually have less to do, right? There's higher
Yeah.
and higher expectations of what needs to be done in every appointment. And so I sort of had one of those moments maybe 6 months ago where I was like, we need to stop picking on the providers. I know they're not
Hmm.
perfect, right?
Thank you.
Right?
Thank you.
But if we're not serving up the information to them consistently in a workflow, right, that's easy for them to click and see the detail they need, sort of shame on us. Let's use the technology to make their jobs easy. So that's how I got there pretty quickly, that it was the right thing to do.
Yeah. Well, sincerely, thank you for that, because I can't tell you how many times in my career people ask us as providers to just like do one more thing or go out to this other screen. It's really easy. Like, we built this other screen over here that if you go there, it's really easy to use. You're not giving yourself enough credit for the empathy that you kind of showed to the provider community with this, in under like stepping into our shoes and what we're dealing with in limited amount of time with the patient in the exam room and the EHR and all the documentation, all the clicks to like really reduce the friction as much as possible to make it easy for us to do the right thing. So yeah, I think you showed a tremendous amount of empathy and leadership in doing that. What has it been like trying to drive change management and kind of earn the trust of the provider community as you're doing this, knowing that there is a long history between plans and providers?
We're at one of those spots where, the health plan has really been a strong performer for the health system for the last couple of years. And in many ways, I think that's given us some credibility. We're viewed more favorably just generally than we might have
Hmm.
been 5 or 10 years ago. And so I think that helps, right? When you just sort of come in being viewed favorably. I've seen, really improved position from providers around how they feel about SHP. I get more, thank goodness this patient was SHP and they could help us get this prior auth through quickly. So there's been this feeling, I think, at least from some segments of providers, that we really have been a good partner. So I do think that helps. But change management is something that probably doesn't get enough time and attention. It's something that I know historically I have not had a proper respect for. And I had a moment. I was working on my MBA. I just finished in December. In one of my last classes, there was a section on change management. So
Hmm.
I saw that it was coming. I was sort of, mentally grumbling and groaning a little bit about it. But as I was going through the material, I had a few of like moments of, oh yeah, I really didn't get this. I really,
Yeah.
and it was a reminder for me that just because things are easy for me to get from, through the stages of change management. Particularly, we use the EDCAR model, which I love
Hmm.
because it's fairly simple. But the book sort of explained everyone goes through the stages at a different rate. So, you start with awareness, desire, then knowledge, ability, and reinforcement. But they had this lovely pictorial of some people take like, little tiny bit of time here and then a huge amount of time, right, in knowledge. Like it takes them a long time to get there. Other people move through quickly. And so in my head, I thought everybody went through the stages of change management at the same speed I did, right? And probably a lot of the ways we approach it, whether it's providers or staff, is about the fastest person or the average person. And we really need to be thinking about the slowest person
Hmm.
in managing change management that way. So I think that was a huge aha moment for me and definitely has me thinking differently about how we need to approach change management. And I think providers in particular, really thinking through each of the steps. We've got providers that are very, technology savvy. They are just going to get it in about 5 seconds. And they'll do it if we make it easy for them. We have other providers, right, that have been in practice for a long time, and this is going to be a big challenge no matter how easy, right, we make it for them. They're not going to trust that the tool is right. They're not right. If they didn't see, touch, whatever it themselves. I think that gave me this new perspective on how we have to think about change management. So definitely we have opportunity. Even as we've gone through the rollout, we don't have as much provider adoption as we'd like yet, and it's probably because we didn't manage the change management piece of it as effectively as we need to.
Yeah, totally. It makes all the difference in the world. My first job out of training was deploying the EHR at UCSF, and oh, boy, did I learn real fast about change management. Those first few months, and as you mentioned, the different provider communities and segments who had very different, all the way from the early adopters who wanted to build and go live tomorrow to the people who wanted to retire early, and would be very angry and upset about the change. So yes, there's always the full spectrum. Can you dive in a little bit more detail in terms of what are these technology strategies? Historically, doing value-based care and creating the infrastructure can be really labor intensive and very hard to do, to move from one world into, from a fee for service world into the value based care world. So how are you looking at technology strategically to manage your costs, to improve your quality, to understand your risk, to drive member engagement? Tell me holistically sort of how you think about those technology strategies.
I think as we look out into the world, there is a technology solution for every possible issue, right, you might consider. And so it can be a little bit overwhelming. I don't know if your inbox looks like mine, but three-quarters are from external vendors that have some great thing that they want to pitch. You kind of fundamentally stepping back and thinking about, number one, what are the priorities that we need to be thinking about, and what are the problems that we need to solve. Because otherwise it would be so easy, right, to implement 10 new
Hmm.
technology solutions every year, each one probably adding value, but also adding complexity to the interaction of our systems, increasing the chance that we actually are driving down customer satisfaction because they're getting pinged from.
Too many
Yes,
different.
absolutely. And so I think there are so many things to think about. There's also risks, right? If you go too far all in with one sort of vendor, and that can make it hard, and not give you the flexibility that you need. And so you have to balance kind of all these pieces. But I honestly believe, we're sort of at this pivotal point in terms of technology and AI and the potential capabilities, right, that are already out there and those that are continuing to sort of come, particularly for healthcare, but I'm sure it's not unique to healthcare. And I get really excited about what we could do in the future. And then I return to reality, and I'm frustrated by the fact that our core operating systems, whether you're a plan or a provider, really keep us grounded in the fee for service mentality because they
Hmm.
don't know how to operate effectively any other way. You can add on a lot of technology to address that, but that's a huge challenge that healthcare in general just has to overcome, because again, otherwise you're plugging in, 1,000 different things to solve one-off issues, as opposed to if you could holistically start with a system that was a little more flexible,
Yeah.
that would put you in a different kind of place.
What do you think? So, I mean, I hear you talking about sort of like papering over symptoms rather than addressing the root of how we operate. What do you see as some examples of those roots that are things we maybe don't even think about, but they're rooted in fee for service and they make it hard to move. Like what are some of those sticking points or fundamentals that need to change that are making it hard to make the transition?
So if I think about our core operating system, for example, and I don't think it's unique. I think all kind of core operating systems, they're not sort of person individual centric, right?
Yeah.
If you had a system that was person centric, then how you paid their claims, right? How you dealt with their quality needs, I think it would look different.
Yeah.
But
Everything is
there,
transactional, right?
right. And I think that distinction, and it doesn't matter again if you're talking about plan or provider, I think it's the same within the provider system. The way that a traditional EHR is set up, it's really not person centric. And this is a person centric business. Our goals ultimately, yes, we want to address population health, but in many cases, you're doing it one person at a time,
Mm-hmm.
right? And meeting that individual's needs, addressing that individual's quality gaps. That's how you get to population health, but a technology system that really enabled you to grab, right, this population of people that are all diabetic, right? This population of people that are all due for their preventive screening. This, however you want to think about addressing it, that would be a fundamental shift that would then allow us to say, and these people are attributed to this system as opposed to this
Mm.
product, this provider, this, health system that sort of makes us say, well, everything has to start on a fee for service basis. And then any value based model has to be sort of on the side, right? You're doing then a bunch of analytics or math or finance stuff, right, to actually true up to the real payment.
Gosh, it's so true that I have two examples that pop into mind as I'm hearing you talk about this. One, you see a lot of health systems billing for every patient message that gets sent, right? Which is like such a transactional perspective as opposed to if you're wrapped around the individual, those messages are actually opportunities to improve their quality, to improve their care, to improve their experience. A chief digital officer group I was a part of, somebody said, well, gosh, in what other industry would consumer engagement be considered a negative as opposed to a positive? So that's one example. And then the other one that popped into mind is how much provider systems we tend to look at the patient experience as starting within our walls. So like if we're, giving somebody scheduling or referrals support, it's only once they actually hit our walls that we think about it. But the truth is like 3/4 of people's healthcare searches start with a friend or a family member or with a Google search. If you're not looking at it through the lens of the person, but as this transactional system, it changes everything.
I totally agree. I mean, I've seen some like journey mapping, right, which starts to get a little bit more at that, but even that starts at the point in time at which, they place the phone call to make the appointment. That's better. That's a little
Right, but
better,
what
right?
happened upstream of that?
There was something, presumably, right, that took place that ultimately made them call this specific office, right, or this specific provider. And it carries through past their visit as well. And again, even past billing and that piece, because sometimes we get all the way out there, right, all the way out to we sent them a bill and they paid it, and that was a positive or negative interaction. But more happens after that too. I think if I could just take $100 or $1,000 or whatever, right, that amount of money for that patient, and say, you just take it and stop worrying about, right, how many messages you have to answer, right, how many visits, and you just use that to take care of them in whatever is the most cost effective and efficient way and meets their needs, go to town. But that's, again, it's very challenging to do with the way that our transactional systems are designed.
Yeah. Where have you seen, or does an example come to mind of a more personalized engagement with the member, with the patient, that was enabled by a shift towards sort of a value model rather than a transactional model? Like what does that look like? Where have you seen it go well?
Yeah, I'm not sure I have great examples. I mean, I can think of some spaces where, through sort of that lens of value-based care, we're working around, hey, we've got somebody that's, again, I'll say diabetic and hasn't been in for a visit, and sharing that, to the provider for outreach. So that feels a little bit more,
I'll tell
the
you,
right
I
way.
mean, you're talking to a endocrinologist, and we don't do that today. We don't
Yeah.
outreach to people. I think that alone is a big shift. We kind of wait for people to come in for visits.
Interestingly enough, because again, to me, this is sort of a no-brainer. But as we're working within our health system, I've had a couple of moments where I'm sort of raising my hand and saying, "Why are we waiting?" Right? I can give you a list of folks that are due for X, Y, or Z. Maybe it's preventive care, right? Maybe they need a prescription refill and they need to come in. I mean, we can tell you, but sometimes we're being very passive, and the best customer service isn't always passive. Sometimes it is, but in this case, I think there can be an element of, we know you, we know what you need, and it's time for you to come in and have your preventive visit, have a screening, have a checkup, make sure that your meds are working for you effectively. Let's check your weight. I certainly wouldn't mind, right, if my healthcare provider was saying, "Hey, I haven't seen you in a while. I know you're healthy generally, but you're a little overdue for some of this preventive stuff." And I think there is an element of, oh, okay, I'm not just a number, right?
Yeah.
They care about me and my health.
And the truth is, like with current technology, you don't need a team of humans to do that. Those kinds of outreaches can be automated.
Yeah, I think healthcare in many ways is miles behind. I think about I'm a Delta flight frequent flyer, and how infrequently I'm dealing with a human, right? When I'm booking my flight, if I have a flight change, there's I'm using a chat bot, right,
Hmm.
for messaging. I mean, and so there is so much that other types of organizations are doing, and we are just, I feel like, scratching the surface in terms of, and again, like, I love that service, right? I don't have to pick up the
Yeah,
phone and call.
it's
um,
really nice.
and I think they're using algorithms to do rebooking, when there's a cancellation. And so, for me, that's, again, it's another, you're making it easy for me to be a passenger,
Yeah.
even when there's a challenging moment.
So yeah, you talked about some of like the consumer world things. You mentioned AI earlier. As you look over the horizon at the next, couple of years, what are some of the emerging opportunities or things that technology you think will unlock and allow you to do that you would not have thought possible 5 years ago? How are you thinking about that?
So I've done a decent amount of reading. I admit to being a bit of a nerd in this area, and I was shocked, actually, at what's already being done. And I read something about an ability that I think will shortly be coming, to create like custom pills. So instead of taking, right, six or seven, they'll be able to custom build pills for folks to improve. So you think about that, that is just amazing, so we don't need those to give out those
Yeah,
pillboxes
imagine what
anymore.
that would do for adherence.
Right, right, make it easy. And so you think across the spectrum, the practical applications of AI, even today, the ability to screen, right? So, there are places where technology is being used, right, to review x-rays, CT scans, whatever, to help in early detection. There are applications where, the wearables, right, where we can actually potentially engage with folks and keep them healthier.
Hmm.
And so I think there are tremendous applications, ongoing applications there. Even diagnosis, right? So particularly probably for primary care providers, that every once in a while they're going to get just an unusual case. And so, what do they do? You go through this litany, right, of tests. What if there's a way, right, to help through technology narrow down what are the possible, or, reading thousands of pages of material to help narrow in on that diagnosis more quickly, and therefore treatment, right, more quickly. And so, like, I think there's all this stuff, right, on the care side that I just think could be tremendously valuable. And then you think about, maybe not as exciting, but still really, really important, applicable, is like the optimization of administrative tasks.
Hmm.
Um, right? So I don't have to pay
Or you're talking to
people.
someone who gets just as excited about those.
Right. Um, but honestly, right, the ability to create an algorithm, right, that does kind of the no-brainer stuff for you, and you don't have to have a person. I mean, we've really leaned into like robotic process automation and have been able to take a layer of claims that used to have to be manually touched for something fairly simple, but now the system can do it. And we can have those claims adjusters working on more complex cases. And again, pick a topic, prior authorization. A huge percent of that, the stuff that goes through prior authorization, is easy to say yes to, and nobody needs to really look at it.
Uh-huh.
And then we can focus our time on those more nuanced or complex, or right, where somebody needs to dig in and understand. Right. So again, I think there's a whole element there. And then finally, and then I'll stop totally nerding out on you, right, is the ability to reach people where they are. The way that technology was when it first came out, right, you had to be pretty savvy to be able to use it. In every year, I feel like it gets easier and easier for different, people to have access. So my standard is my 93-year-old grandma, right? Um, so I see a future where my grandma, because technology is so easy to use, can actually use it, because it's voice activated, right?
Yeah.
Or personal assistant type of technology is gotten along far enough that it can sort of help support her in independent living. And so, I think, there's a ton of applications that I see, in a huge potential for the future to be different and better because of it.
I hear a lot of them in your comments also that I'm excited about in terms of better synergy between the plans and the providers, right? Like if there's technology around prior authorizations, around referrals, around quality and understanding risk, and those data are better flowing between plan and the systems are more integrated between plans and providers versus completely disparate, not talking to each other. Those are real game changers.
Yeah, I mean, you think about a system where there are clinical standards, right? Clinical guidelines for so
Yeah.
many things. There could be a point at which those are sort of turned into, right, some kind of technology, which then can just be uploaded into the system, and the systems are talking to each other, and prior auth goes away, right? Because the provider EHR is set up to follow, right, the clinical guidelines, and the plan side is set up to sort of validate.
Don't
And
make humans do something that a computer can do. That's it,
yeah.
right? I'm curious. I think two more questions. My last one will be my favorite question, which is hearing what you like to read and where you get your information from. But before we go there, any advice for others who are looking to follow in your footsteps in terms of bringing plans and providers closer together, leveraging technology, leveraging leadership, leveraging change management? What advice do you have for others?
I mean, I think the first one is to be curious and ask questions. Don't be afraid about what you don't know, because I will tell you, a lot of times I'll ask a question. I'll be like, I'm perfectly comfortable being the dumbest person in the room, if that's the case. But often when I ask a question, you realize, okay, nobody else knew. Everybody else was wondering the same thing,
Yeah.
or nobody else thought of that, right? And it spurs good dialogue and converse. So I think, asking questions, making sure you understand, being curious, but then also being a good listener, and always keeping sort of your ears open to, what's happening. I think sometimes we make really, really complex solutions for really simple problems because we just didn't listen, or we didn't ask enough questions. I know, just in working with Notable, I've probably asked thousands of questions, right,
Hmm.
throughout the relatively short amount of time that we've been working together. And I think it's brilliant, right? I think what you all do is brilliant, but I didn't think that on day one. It took me a long time to sort of get to a place where I felt like I understood and was comfortable. So those are my kind of two. If people did that, I think it will lead you, whatever the topic is, right, to the right decision most of the time.
Yeah. So, okay. So, final question. Speaking of curiosity, you sit down Sunday morning with a cup of coffee, what are your go-to reading sources? What do you pull up to learn about, your space, your portion of the industry? What are your go-to sources?
So I am admittedly, I love to read. It's my absolute favorite thing to do. I will tell you, I spend outside of my office hours, I spend a disproportionate amount of time on fun reading. Compared to industry, but I
Yeah.
certainly I love to page through modern healthcare, HFMA, because I have that finance background, and often there's really some interesting articles that come through there that even are a little bit tangential. So those are two big ones for me. I also like to, if I have a particular topic of interest, I know how to use Google pretty effectively. And so, again, like, thinking about AI and robotics, I've done a ton of searches and, just like you find really cool and interesting articles just by, picking a topic of interest and sort of seeing what pops up and from different sources. So, those are a few. And then, certainly I read Becker's regularly to kind of, that's more a little more kind of boring standard, which hospital
Yeah.
acquired which hospital, that sort of thing. But just knowing that is also important as well.
Well, thank you so much, Krista, for spending the time together. It's always fun to catch up. And again, I thank you for the empathy and leadership that you've shown in leading towards value-based care and bringing the plan and provider worlds closer together.
Well, thank you so much. I enjoyed being here and, happy to chat anytime. I've got lots to say on all kinds of different topics. So, anytime that you want to connect, I'm happy to do that.
All right, take care.